Blog Talk Radio.
Hello, everyone, and welcome to After Dark Radio at blogtalkradio.com. I am your host, Anthea. And my website is catsanddogsnaturally.com. Let me just throw that in right now. Anyway, today I'm going to discuss skin problems or atopic skin disease in dogs. And skin problems is probably the number one condition I see at my consultation practice. That's usually what pet owners will contact me about. Their dog is scratching like crazy, or they have hot spots, lesions, hair loss, and so on. The holistic approach to skin condition is to look at the whole picture. It's about looking for the cause and then removing the cause of the disease. It's not about only treating the symptoms. You address that too, of course, but addressing symptoms through suppression is only a temporary relief. But what will really happen through drugs like NSAIDs, non-steroidal anti-inflammatory drugs, suppression pushes the disease deeper into the body, which will make it more difficult to fix. The skin always shows what's going on inside the body. Therefore, some of these skin problems is from underlying illnesses like hypothyroidism, which does havoc on the endocrine system, and it'll cause things like flakiness, seborrhea, and hair loss. Then there's vaccines. The Lepto is a notorious vaccine that is known for causing 4 years of dermatitis and pruritus. And I would say the majority, if not all, of the skin problems I see in dogs occurred shortly after getting vaccines, any vaccines, including rabies. It usually shows up 1 to 2 months after a shot. Then there are allergies, which can come from environmental, like pollen, chemical, or food allergies. Now, in a conventional point of view, the first approach is to find out what the dog is sensitive to. The veterinarian will start off with giving fatty acids in the diet, and then he'll move on to drugs like antihistamines, and they'll switch the antihistamine drugs around to find out which one will work. If the itchy skin still continues, they'll add oral corticosteroids, and if that doesn't work, they use hyposensitizing vaccines, which can take up to 9 months to even work properly. And for conventional allopathic treatment, interferons and topical or oral glucocorticoids and oral cyclosporin, it remains the most efficient, and they'll tell you that it's, from an allopathic point of view, a relatively safe choice, but I don't know about that. With these immune suppressant drugs like cyclosporin, you run the risk of infections, neoplasia, renal failure, or hypertension, especially after long-term use of that drug. But that's not where we want to go. We want to go natural and holistic. We need to look at other things. We're looking for a cause so that we can address this cause and remove it. And sometimes it's the obvious. Sometimes it's parasites like fleas or scabies. But if that is ruled out, then the next step is allergy testing. There's a 10% chance of finding a food allergy, and then there's a 90% chance it's a atopic dermatitis. Now, with commercial pet food, there's a lot of ingredients that can cause problems, even with the hypoallergenic diet that your veterinarian will prescribe. In these diets, in these commercial pet foods, you have chemicals, you have coloring, you have GMO, you have starch, you have the possibility of microtoxins contamination that can contribute to allergies. And this is why I prefer a species-appropriate diet of raw meat and bones. It's natural, it's what the dog is supposed to eat, and there is no chemical additives. And once on a raw diet, then we can do elimination diet to see if the dog is sensitive to certain proteins. Now, it's said there is a genetic basis in atopic skin disease, but can we actually change the epigenetic factors that switch on or manifest the signs of genetic diseases? Well, yes, we can impact the expression of atopy. And there is no magic bullet. There is just no one thing that you can go to for this, but there are things we can do to offset this problem. We can, first of all, the most important thing is boost the immune system. You can use something like medicinal mushrooms, for example. And then there's other things to look at, is stool quality. Is there any gastrointestinal issues? 80% of the immune system is in the gut. And if there's an imbalance there, it can show up on the skin. Where the dog sleeps can play a role of dust mites. Dogs could be allergic to dust mites. If the dog is itchy during the night or in the morning, you might want to eliminate the possibility of dust mites. In a situation like that, you may want to get a dust mite cover on the dog's bed, or if he sleeps with the humans, maybe a dust mite cover for the human's bed. And another factor in atopic skin disease is anxiety and stress. There's a very strong link between behavior and what's going on with the skin. As I mentioned before, allergies from the environment, and this would include mold, insects, grasses, pollen, mites. 70% of dogs have a chance of being sensitive to dust mites. Then there's dander from other animals, and then but there's very little we can do to control what's outside the environment, like the trees and the flowers and the bushes and grasses that are growing. We can't control that. But we can control mold, and we can control mites and fleas. You can try and wash suspected areas of mold in the house with vinegar and water. I mentioned how we can control mites. Fleas can be a challenge, but if you're persistent, you can control them. And you know how some people can be allergic to animals? Well, some animals are allergic to humans. They don't like our dander. Air pollution is another thing. There was a study 2 years ago in Canada, that would have been in 2015, regarding allergic sensitization in children with atopic skin disease and air pollution from traffic. And they observed a strong correlation in the first year of life in children with skin problems to traffic pollution. And I thought this was interesting. This association was stronger among children not attending daycare compared to children that were going to daycare, and I don't know why. I mean, was there more traffic pollution at home? I mean, was the ventilation very poor in the children's home? The study didn't even go into that, didn't even make that clear. And I think the first thing we should do when we have a dog with atopic skin disease is to at least identify and eliminate antigenetic stimulus, whether it be in diet or fleas or mold, before you go to the drugs. I'm a drugless practitioner, so I want to avoid that, and I want you to avoid that. And and as I mentioned before, the dogs can still be allergic and have allergic reactions when they are fed hypoallergenic dog food that the vet will prescribe. Well, it was found, for those out there who are still feeding dry food, shame on you, but it was found that unopened commercial dry dog food was contaminated with storage mites. And it has a lot to do with the way bags of dry food are stored. Like we stick it in the cupboard, you stick it under the sink, wherever you stick it, under the sink, wherever. And the way you store it, like in a warm cupboard, that would increase the number of storage mites, and they find that it's just moderate temperature. It doesn't have to be really hot, but it's moderate temperature and high humidity will increase the number of storage mites in your dog food, in the dry dog food. Throw it out anyway and move on to raw meaty bone diets, and you won't have to worry about that. So the naturopathic approach is to do what I've mentioned so far, identifying and reducing the anti-genetic load, and the naturopathic approach is to avoid drugs, and we want to look at each dog individually. And if a dog with atopic skin disease is obese, I want to get the weight down, and that helps reduce inflammation. And then there's stress. Stress is involved. I want to use adaptogen herbs. And if a dog has a poor diet, I want to look at leaky gut and the dog's microbiota. I usually like to detox the animal, either through herbs or homeopathy, to help remove chemicals and toxins from the dog's body, especially for dogs that have had a long history of drugs like antibiotics and steroids and vaccine use. And they say that 10 to 30% of dogs with non-seasonal chronic pruritic dermatitis have adverse food reactions. And this can be triggered by histamine-releasing foods, like fish products. The way fish is processed can release histamine. Then there is the excess carbohydrates in the diet, and that can lead to bacterial changes in the gut. And then there's exophins, which is from milk and dairy protein products, and that can trigger adverse food reactions. So we want to look at that. And I just can't emphasize the diet enough. There are so many studies coming out that show the immune system through the gut can be manipulated by the diet. Now, getting back to stress. There's been studies that show stress altering the fundamental microbiome in the gut. And if that is being affected, that means the immune system is being affected, and that's going to affect the animal's health and skin diseases. So stress can show up in the skin. Nutrients are important, such as zinc, essential fatty acids, and vitamins like A, D, and E. Now, zinc is an important mineral to treat skin problems. When a dog is stressed, he'll actually need more zinc in his diet. And there was a study that showed the synergy between zinc and linoleic acid, which you can find in butter. When you take linoleic acid on its own, or you take zinc on its own, there is an improvement in the quality of skin and coat of the dogs. But when you take them together, linoleic acid and zinc together, the skin and coat improvement it's twice as better. It's even better. Fish oils, omega-3s, have shown to decrease pruritus in dogs by 38%. So oils are very essential. Fatty acids, the oils are very important in the dog's diet. And B vitamin supplements help improve their fur quality. That makes it nice and soft. And then a combo of aloe vera, curcumin, taurine, and vitamin C will help improve dry skin. And there are plenty of herbs that can help in atopic skin disease, such as licorice. It's anti-inflammatory. And then we have there's Chinese herbs like yin gan san. That's a Chinese formula, which is anti-itch, anti-stress formula. We can also, there's been human studies that have shown oolong tea to have a moderate to a very marked improvement in atopic skin problems just after 1 month by 54%. And that's because oolong tea has anti-allergic properties in the polyphenols. Now, I'm not saying your cat and dog should be drinking cups of oolong tea, but you can use green tea. You can add a little green tea to their diet, or you can apply it topically to the skin, like in a spray. And then there's other topical herbs to apply to the skin, some spices like star anise has inflammatory properties. Then you have Schizandra. You have Rehmannia, which inhibits histamine and from being released. And you can also use a skin wash of rosemary or sage. And acupuncture is also a good way to help your itchy dog. And if you can't get to an acupuncturist, you can do acupressure. For stopping the itch, there are 2 points that you can look for. It's liver 11 and heart 3. Anyway, I just wanted to jump on board for a few minutes and just give you a few tips on itchy dogs and your atopic skin problems in your dogs. And this is going to end my talk for today. And please visit my website at catsanddogsnaturally.com. I have tons of articles and on many different subjects. And it's, I appreciate you being here, and I'll talk to you soon.